Welcome to Module 2 of Crush the Crave initiative, entitled Tobacco and Oral Diseases, Dental Caries, and Oral Cancer. As we are aware, tobacco use has negative effects on oral health. Several studies have demonstrated an increased risk of dental caries in smokers. Evidence suggests that tobacco use is associated with a significantly higher decayed, missing, and filled teeth, or DMFT score, untreated decayed surfaces, and missing surfaces compared to non-smokers. The risk is particularly evident in individuals who smoke more than 15 cigarettes a day. Other factors such as effective brushing technique, increased consumption of sugar in tea or coffee, less frequent visits to the dentist, and reduced usage of dental aids such as dental floss increase the risk of caries in smokers. Moreover, sugar, which is an important risk factor for the development of dental caries, accounts for 20% of the total weight of natural tobacco. In addition, tobacco products contain added sugars and sweeteners, which can contribute to an increased prevalence of dental caries. Different forms of tobacco are available in the market. Tobacco in the form of cigarettes, cigars, and smokeless tobacco, and environmental tobacco smoke. As shown on the slide, each form of tobacco influences the development of dental caries in various ways. Dental restorations are the main treatment option for dental caries. Tobacco smoke is made up of a visible mist of several liquid particles or chemicals suspended in a colorless gas that can damage dental restorations. Studies suggest that polyaromatic hydrocarbons and amines in tobacco smoke can make amalgam fillings porous, making them lose most of their strength. Smoking also causes failure of anterior direct composite resin restorations. Tobacco use can have a substantial impact on the risk of dental infection and its subsequent treatment. Current cigarette smokers are 1.7 times as likely to have root canal treatment compared to those who have never smoked. The risk of root canal treatment increases with increasing number of years of exposure and decreases in proportion to the length of abstinence from smoking. Oral cancer is the second most common cancer in India. Tobacco use is a major risk factor for the development of oral cancer. Tobacco is one of the factors that damage the mucous membranes and initiate precancerous processes. The risk of precancerous conditions such as leukoplakia and erythroplakia is increased with the use of tobacco. Leukoplakia, which has the potential to turn malignant, occurs approximately 6 times more frequently among smokers versus non-smokers. The higher the frequency of smoking, the greater risk of oral cancer. The risk of developing oral cancer is 2.3 times higher among smokers who smoked less than or equal to 20 BDs or cigarettes per day, and 8.3 times higher among those who smoked more than 20 BDs or cigarettes per day, compared to non-smokers. Chronic smoking leads to increased mortality from cancer-related causes. Smoking cessation significantly reduces the risk of mortality in patients with oral cancer. Smoking increases the symptom burden during and following treatment for cancer. Targeted cessation efforts for smokers help decrease the symptom burden, limit the likelihood of treatment interruptions, and increase the quality of life. Smoking cessation can largely improve the cancer prognosis and quality of life of cancer patients. Dentists play an important role in counseling patients on smoking cessation. The slide shows the 5A model, which can be used to talk to patients who are willing to quit and to deliver the needed advice. The 5A model consists of 5 components: ask, advise, assess, assist, and arrange. Nicotine replacement therapy is an effective tool for tobacco cessation. It reduces the urge to consume tobacco, as well as helping manage withdrawal symptoms through delivery of nicotine. Use of NRT for the recommended duration, 8 to 12 weeks, is associated with a higher likelihood of quitting. According to a study, the rates of quitting were highest among those who used NRT for the recommended duration of 8 to 12 weeks, and quitting rates decreased proportionally with decreased duration of NRT use. Nicotine replacement therapy can support temporary abstinence during inpatient stay of smoker cancer patients, providing an opportunity for permanent smoking cessation. Thus, timely advice from dentists can be effective in motivating patients to quit smoking. According to a study, only 1/3 of dental faculty or students were aware of the dosage, mechanism of action, pharmacology, duration of the prescription, brand name, side effects, contraindications, and availability of NRT. Lack of awareness about NRT was a major barrier to the use of NRT, followed by bitterness, availability, cost, and fear of addiction. Creating awareness among dentists regarding NRT may help address the barriers to NRT prescription. Let us look at each of the barriers and ways to tackle the same. Lack of awareness. There are numerous awareness drives on all available media that provide valuable information about NRT. Bitterness. Flavored nicotine chewing gums reduce the bitterness of nicotine. Availability of NRT. NRT is available at all private pharmacies. Cost. NRT is comparatively more economical than the long-term cost of tobacco products. Fear of addiction. Nicotine gums or patches can be used as long as needed without any time limitations. Nicogum is a chewing gum containing nicotine, which helps individuals who smoke or chew tobacco and gutkha to quit the habit and works on the proven principle of nicotine replacement therapy, NRT. Nicogum is available in two strengths, 2 mg and 4 mg. 2 mg is appropriate for those who smoke 20 cigarettes a day or fewer, whereas 4 mg is appropriate for those who smoke more than 20 cigarettes a day. The 2 mg form of Nicogum is administered as 8 to 12 pieces a day, not exceeding 24 pieces of gum a day. The slide shows a sample dosage schedule for 2 mg Nicogum and steps to chew Nicogum for maximum benefits. It is very important that the individual should not eat or drink or use removable dentures with the chewing gum in the mouth and avoid drinking anything for 15 minutes before the chewing gum is used. Congratulations for completing Module 2. Thank you for being a part of this unique CIPLA initiative to build a tobacco-free India.